I do computer work and type pretty much 8+ hours a day. It's been going on for more than a year. It's difficult to do things. I'm losing grip strength, and it's difficult to sleep with the pain. It seems to be worse at night. I've been wearing wrist splints like this one since April. Since May, I've been wearing elbow pads to go with the wrist splints. These are to minimize pressure or impact and to take care of cubital tunnel or carpal tunnel and cubital tunnel. And last month I was given this to wear as a replacement for these on this hand, and this immobilizes the arm at a 70-degree angle. And I sleep in these, I work in these, I eat in these, pretty much do everything in these.
Now we're taking a thermography of the right medial arm and elbow. We see a very distinct hypothermic area above the elbow. Now we performed the first MRT treatment to the medial elbow and arm, and we can see a significant improvement in the thermography temperatures from the brown to the aquas and pinks, which is an increase of at least 4 to 5 degrees centigrade.
This arm's had 4 treatments. It's much softer, it's much more pliable. I have greater freedom of movement. I don't feel any stretching or tightness when I move my hand or arm.
How about the symptoms, the numbness, the aching?
That's all gone away. I have feeling has been restored in these 2 fingers, and I really don't have any of the carpal tunnel or cubital tunnel pain except for a little bit right down here. That's pretty much it. It's pretty much better. It got cold outside this week, kids, so I started plugging up drafts and got a hammer and screwdriver out, tore off some base molding, and worked a caulk gun and caulked up some cracks and crevices, and spent maybe 3 hours doing that and replacing the trim when I was through, and didn't have any problem. Was able to use the caulk gun normally. Put quite a bit of strain gripping it and squeezing it, but I didn't have any pain to speak of. Was able to use it normally and actually do a chore around the house.
Okay, Jeff, you've been receiving the MRT treatment for thoracic outlet, cubital tunnel, and carpal tunnel. I'd just like to give your response to what you think the value of this treatment is for this condition.
I think it's great. When I started coming in late November, I felt like my hands were about to fall off. We fixed that problem real quick, and been getting back to almost normal. I have feeling in all my hands, or all my fingers now. Something about chronic pain that's just chronic, not to be smart, but it's just chronic. And through this therapy and everything, the chronic pain is not chronic anymore. Without this therapy, I don't know where I'd be. I'd probably be perhaps crippled or not able to do much of anything. That's the route I was sort of falling into. About the November time frame, when I felt like my hands were about to fall off, I was investigating voice computer options and to allow me to speak instead of type. If that hadn't worked, I'd probably have to give up my career or typing altogether. It was just becoming unproductive or unhealthy to continue. With the treatment, when I'm still working and feel fine. Between my neck, my elbows, and my wrists, this is, I think, the only thing we could have done. I've heard horror stories of surgery, and that's the last thing I wanted to do. This definitely has value.